This is my Preparator series for NEET PG. Concise, exam-oriented notes for first revision. Let's start. Today we are revising supports of genital organs integrated across anatomy and gynecology with an exam-oriented approach. The first subject is anatomy. The first concept which we are going to learn about is the de Lance's classification of supports of genital organs. In order to understand this classification, we need to divide the vagina into an upper part, middle part, and lower part. Upper part of vagina is labeled as level 1 in this classification. The arrangement of genital organs from the posterior to the anterior aspect are as follows: rectum, vaginal vault, and bladder. The structures which form the supports of level 1 are cardinal ligament and uterosacral ligament. Cardinal ligament extends from the cervix and the vaginal wall to the lateral pelvic wall. The uterosacral ligament extends from the cervix and vaginal wall to the sacrum. Middle part of vagina is labeled as level 2 in de Lance's classification. In order to explain the supports of level 2 clearly, I have divided the middle part of vagina into a layer which is present above and a layer which is present below. But the arrangement of genital organs in both the layers are the same. From the posterior to the anterior aspect, the arrangement of the genital organs are as follows: rectum, middle part of vagina, and bladder. In the layer which is present above, the structures which form the supports are arcus tendineus fascia pelvis and endopelvic fascia. Arcus tendineus fascia pelvis is the thickened pelvic fascia extending between the ischial spine and pubic bone on both sides. Endopelvic fascia extends from the anterior vaginal wall to the pubic bone and lies in between the two sides of arcus tendineus fascia pelvis. In the layer which is present below, the structures which form the supports are arcus tendineus levator ani and rectovaginal fascia. Arcus tendineus levator ani is the thickened levator ani fascia which extends from the ischial spine to the pubic bone. Rectovaginal fascia extends from the posterior vaginal wall to the ischial spine in between the two sides of arcus tendineus levator ani. The lower part of vagina is labeled as level 3 in de Lance's classification. The structures which form the supports in level 3 are the urogenital diaphragm and the perineal body. Urogenital diaphragm consists of muscular components and facial components. In the facial components, there are two fascias. In order to explain these two fascias clearly, I have divided the lower part of vagina into a layer which is present above and the layer which is present below. In the layer which is present above, the supports which we can see are the perineal body first. Perineal body is the central tendon of the perineum. The first muscular component of the urogenital diaphragm is the deep transverse perineal muscle, which extends from the ischiopubic ramus and joins at the perineal body in the center. The second muscle is the sphincter urethrae, which encircles the urethra. The third muscle is the urethrovaginal sphincter, which originates from the perineal body, encircles the lower vagina and the urethra, and joins at the perineal body. The fourth and the final muscle is the compressor urethrae, which originates from the ischiopubic ramus, forms a sling at the anterior aspect of the urethra, and joins to the ischiopubic ramus on the opposite side. With this, the four muscular components of the urogenital diaphragm are explained. In the facial component, there are two fasciae. Only one fascia is seen in this layer, which is the superior fascia of urogenital diaphragm, which lies above all these muscular components of urogenital diaphragm. In the layer which is present below, the leftover one more fascia of the urogenital diaphragm can be seen, which is the inferior fascia of urogenital diaphragm or the perineal membrane, which lies below these muscles of the urogenital diaphragm. The next subject which we are going to study is gynecology. The concept which we are going to learn in gynecology is consequences of damage. If the level 1 supports are damaged, the consequences which we can expect are the enteroceal, vault descent, and uterine descent. Enteroceal is the descent of intestinal components, as you can see in this image. Vault descent is due to the descent of vaginal vault. Uterine descent is due to the descent of uterus. If the level 2 supports are damaged, the consequences which we can expect is the cystocele, which is due to the descent of bladder, and rectocele, which is due to the descent of rectum. If the level 3 supports are damaged, the consequences which we can expect are the deficient perineum, which leads to gapping introitus. Gapping introitus is the laxity of the vaginal wall, which you can see in this image. And urethrocoele, which is the descent of urethra. That's it for this topic. See you in the next one.